Hello and welcome to Spinal Chat episode 4. My name is Dr. Ivan Stoev and I'm a board-certified neurosurgeon practicing in Nashville, Tennessee. Today's episode will focus on artificial discs in the cervical spine. Now, in the previous episode, I covered the anterior cervical discectomy and fusion procedure and the indications for that and also the downsides. The indications for an artificial disc surgery are very similar to the fusion procedure. And just to summarize and recap from the last episode, those include degenerated discs that are herniated and causing pressure on nerves or the spinal cord. Also, deformities of the cervical spine such as kyphosis, which is the reverse curvature of the cervical spine. So, one of the major downsides of having a fusion surgery is the loss of mobility. You lose about 8 degrees of flexion extension with every single level that we fuse. So the more levels we fuse, the more loss of mobility in the neck, and this is a permanent loss. The other problem is the phenomenon known as adjacent level disease, and this is the thing that concerns neurosurgeons the most, because that leads to an accelerated degeneration of the disc above and the disc below the fusion. That rate is 2.8% per year. And it's a cumulative rate over the following years after surgery. So, in order to avoid this problem of adjacent level disease, we have devised artificial discs. But before we go into discussion of how the artificial discs are inserted and how they function, I want to explain to you why this adjacent level disease occurs. It occurs for 2 reasons. The first reason is that when you fuse a portion of the spine, the rest of the spine has to take up that slack. It has to take up that function of the fused segment. In order to maintain normal physiological function, there is an increased strain on the discs that are left intact. Another reason for that is the principle of lever arm. Now that comes from physics. The lever and fulcrum principle basically states that the longer the level arm, the greater the forces at the end if there is a fulcrum applied there. And this is the reason why if you have a torque wrench with a very long handle, you can generate a great force at the end versus a wrench with a shorter handle. In essence, the fused part of the spine acts like a lever arm. So there's an amplification of forces at either end, which is the level above and the level below. And that increased demand leads to degeneration and wear and tear. So the artificial discs are designed to preserve the natural mobility of the neck and therefore eliminate that adjacent level problem. This is one type of an artificial disc called a Bryan artificial disc. It's an older model that I no longer use, but in essence it is a device that is encased in this rubber housing, and inside is the mechanism of the artificial disc. This is a little outdated, so I no longer use that. My disc of choice is this one. This is called the Prestige 2 artificial disc. And it is made out of 2 titanium plates that form a ball and socket joint, and that allows for movement in all 6 degrees physiological movement in the cervical spine. That includes flexion and extension, lateral bending, rotation, forward and backward translation, and an up and down movement. Now you may say, how is this held together because they're 2 separate pieces? Well, the truth is that it is held together in place by the ligaments and the tendons that are present in the spine. So the function of the disc is to provide weight support and also to provide this mobility. Now, the procedure to insert this disc is very similar to the anterior cervical discectomy and fusion procedure that I described in the previous episode. The only difference is what we place in the disc space. The incision is the same, the duration of surgery is fairly similar, and the recovery time in the hospital stay and everything else is very similar to the fusion procedure. Now this device, it's hard to see, but there are little teeth on the surface of it right here that engage in the bone, And the surface is also porous, allowing for bone interdigitation or growth within the implant, and that makes it very durable. Another reason I like this disc is because of its simplicity. It really has just these two parts. So there is very little chance of mechanical failure. So why do we even talk about spinal fusion? I mean, if the artificial discs are much superior in preserving mobility and preventing this adjacent level disease, why do we even put people through a fusion procedure? Everybody should be getting artificial discs. Well, it's not that simple. And it all comes down to patient selection. It is of paramount importance. There are certain criteria that have to be met before you're a candidate for an artificial disc. And the most important one is the health of the facet joints in the back of the neck. If you have a lot of degeneration, a lot of wear and tear of those facet joints, then you're not a good candidate for an artificial disc. When you have a degenerated disc, and this is the reason that the procedure is done, so obviously everybody is going to have some degree of degeneration or they're not going to be having a procedure done, that's oftentimes accompanied by degeneration in the facet joints in the back. Now that segment that is degenerated does not have the normal range of motion that a normal spine would have. The disc is more stiff, more firm, less flexible, and the joints tend to be overgrown and deformed. So they don't actually have the ability to undergo the full range of motion. So now if we replace the diseased disc with a healthy titanium disc, that would allow a full range of motion of the neck. And that would basically ask the facet joints to do the job of a normal joint. Well, they haven't done this in a long time because this degenerative process takes years to develop. So all of a sudden, we're asking those really unhealthy joints to do a normal job. And they're not happy about that. So that leads to chronic neck pain. The second factor to consider is the number of discs that need to be replaced. Now, the Prestige 2 disc that I showed you before is approved for only 2 levels. There are other companies that make different types of discs of different configuration and structure and mechanics. Some of them are approved for 3 levels, but the truth is, in my personal opinion, is if you need to have 3 discs replaced, the likelihood is that you have pretty extensive degenerative changes throughout your spine, and that will probably preclude you from being a candidate for the artificial disc. So you might be better served by a fusion in that case. Now, I want to thank you all for joining me today for a discussion of the artificial disc surgery. And as always, I appreciate all the subscribers and all the followers and all the comments and questions below. I try to answer them in the following video, the following week. So feel free to leave your thoughts and comments below. And I want to thank you again for your time with me today.